Hi, everyone. I'm David Gray. In response to the discussion post, I do believe healthcare is ready for disruptive innovation, not without its obstacles, of course. I really don't think it's the innovation itself that would be an obstacle. I think it's more the healthcare organizations and how quick or slow they are to adapt the innovation. And I think there's just a track record in healthcare where they're very hesitant to adapt new things and change their processes. Ultimately, I think any innovation that disrupts the market and helps patients is really the way to go. I don't know. I see kind of see this in my own job, and it relates to me a little bit. I work in the business development area for HMG radiology specifically, and part of my role as a physician relations um, person is to basically market our radiologists' internal initiatives to physicians, other offices to ultimately help patients with more specialized exams. An example of that is this AI software called Icometrics. It's basically, like I said, an AI software embedded into an MRI machine where along with a regular band MRI, you can see in real time a objective report that shows brain atrophy, brain health, brain volume for the physicians. And you can use that information at a bird's eye view to gauge how far along these cognitive issues that patients are experiencing. So it's it's a way to detect dementia a little earlier than a regular brain read will give you. So it really helps the patient, and it's really good for them, especially with the elderly that are experiencing cognitive decline. Um, so with all that being said, the providers can think that that's impressive technology, but that doesn't mean that they'll automatically going to start using it. I have to build trust with the provider, the office, um, tell them that there is a change to workflow, but not that much, which is a benefit to this initiative. Um, it's really just about making them comfortable with trying something new. And that's just a small example of how overall healthcare struggles to adapt to things they're not familiar with. Um, but to me, that's kind of what healthcare is all about, where all of this is for the patient. So it's you are creating all this technology and all this innovation that helps the patient, but it also helps providers see that this technology would really in turn improve patient care and make their jobs less difficult. Um, I mean, all these tools can be created to save time and help accuracy in reading for imaging as an example, and potentially catch a disease early like dementia. And the best way to combat dementia is catching it early. Um, I mean, off the top of my head, an innovation that I see is like you have telehealth. I just had a telehealth appointment the other day. It's becoming much more common. A lot of healthcare sectors utilizing AI. It's running rampant in literally every corner of healthcare that I see. Um, and some of the procedures now are being done outpatient, which saves the patient a lot on insurance costs or out of pocket costs, which is a huge benefit. And all of that wouldn't be happening if there wasn't disruptive innovation in the healthcare sector. Um, but I guess healthcare also needs to be conscious for good reason because this is all to serve the patient, and that's very delicate to care for the patient, but with also testing the technology or the innovation, and just to see how you can integrate that tech or the innovation into patient care. There's a lot of factors, and a lot can go wrong, but a lot can also go right and push patient care forward for the better. Um, so anyway, like I said, I really do believe that healthcare is ready for disruptive innovation and has been for a very long time. Um, but it takes intention, education for who is working with this innovation, um, ensuring that processes are in place correctly to have this be adapted as easy as it can. You just have to make sure that you have that trust to help serve patients and build a rapport within healthcare because it all starts with the people working in it. So that's just my point of view.